Okay, hello everybody. Oh, I love this chart. It's great. Good morning or good afternoon, everybody. Thank you for coming, and I'm proud to be joined by my colleagues. And I'm also want to give special compliments to our chart maker. Now look at the little touches on this chart. First, have you ever seen such beautiful exclamation points? And second, exposing ripped.
Who did the chart? Oh, nice.
So special compliments to our chart makers wherever they are. Okay. Anyway, it's true. I'm not joking. I'm very serious about how great the chart is. Okay, thanks for I am very serious. Yes. I want to thank my colleagues are no joking matter either. And they are great colleagues. It's Senators Murray and Smith and Stabenow and Kelly and Warnock. Now, why are we here? We're here today to talk about the very real dangers of Project 2025, the agenda Donald Trump's second administration would adopt, should, God forbid, he return to office. For all the chaos and disaster of the first Trump presidency, it pales in comparison to the harmful ways a second Trump presidency would impact our country. Project 2025 is the Trump agenda. Make no mistake about it. People within his inner circle wrote it. Over 200 former officials of the Trump presidency were part of the project, and they wrote it as the blueprint for him. Many of these individuals could very well rejoin a second Trump administration and be in charge of implementing policy. Project 2025 would be their how-to manual. And what are the Republicans hiding in Project 2025? An American nightmare. The most conservative, unhinged, and extreme agenda we've seen in modern times. Trump's first term in office wouldn't hold a candle to the ideas of Project 2025. Today, my colleagues and I want to talk in depth about some of the absolute worst of the Project 2025 policies. So let me hit on some of the most destructive things. And it's on this chart. First, on education. It would abolish the Department of Education and eliminate Head Start. 2.9 million children have Head Start. And Republicans claim they care about families, but eliminating Head Start means Republicans want to kill a program that everything shows makes it far more likely that low-income kids graduate high school, attend college, earn more money, lead healthier lives. They want to kill it, eliminate it. That's right in their proposal. And these are, there's so many bad proposals. We've just picked out a few. Healthcare Project 2025 would send the cost of healthcare and prescription drugs soaring. They repealed the $35 insulin cap. $35 insulin cap is one of the most important and popular things we've done. We hear about it everywhere we go. You can be in a blue state, a red state, a purple state. Everyone is so happy that insulin's afforded, they want to eliminate it. Women's health care. Project 2025 would intensify the GOP war on reproductive freedom by laying the groundwork for a national abortion ban. And it also pushes states to monitor women's pregnancies. Women of America hear that. They're thinking of monitoring women's pregnancies. They want the states to do that. Housing affordability. Finally, Project 2025 would make it harder for Americans to own a home. They would privatize Fannie and Freddie. That's going to make mortgage rates go up. It causes dramatic spikes in mortgage rates, makes it much harder to buy a home. So, folks, this is sinister stuff. The vast majority of Americans oppose them, yet it's precisely what the hard right is promising the American people if Donald Trump returns to office. Now, each of my colleagues will elaborate on some of these, and I want to first call on Senator Murray to talk about health care. Education. Sorry. Got it.
Okay. All right. Well, thank you. I have a stark warning for parents about what a second Donald Trump administration would mean for our families. Trump has said clearly and publicly he wants to slash education funding in half. In half. That sounds unthinkable, right? Impossible, right? But this isn't just Trump bluster. Project 2025 shows this is something that Republicans are seriously planning for, and their plans would have serious consequences. Project 2025 calls for ending Head Start. That is a program that has given millions of parents a start in early childhood education. It calls for choking off funding for schools in our low-income areas, including many in our rural communities. It calls for taking student lunches away from some students. This is really wildly out of touch with families and out of touch with reality. Do Republicans think rural communities need fewer teachers and public schools? Do Republicans think we should have less support for students with special needs? Do they think any parent wants to lose Head Start? Do they think any student wants to go to school hungry? Because that is what Project 2025 means, and that is what Trump is promising. Another promise, and this is direct from Donald Trump himself, he is going to cut off funding to schools with vaccine requirements. That should raise so many alarms and so many questions. Why does Trump want a measles outbreak? Why does he want to bring back polio? Do we seriously think we came through a COVID pandemic only for Trump to think, how can we make it worse next time? I mean, does he even understand what he's talking about? Every single state in this country has basic school vaccine requirements. I will tell you, as a former preschool teacher, I have to say that I think a preschool student could have written a better education agenda. Seriously, though, it is unimaginable to me that we would cut our school funding in half, or fire teachers, or leave kids in the dust, and tell our parents and students and teachers and schools across the country, sorry, you're on your own. Our public schools are the backbone of our country's strength, and it is the foundation of our future. Fighting for that future, fighting for our kids, is what drove this mom in tennis shoes into politics. And it still drives me today. So I will keep speaking out loudly about how Donald Trump and Project 2025 would put our kids' future in jeopardy.
Senator Stabenow, women's health.
Yes, thank you so much. Well, first, let me say Republicans and Donald Trump obviously have made this very clear. And we're all today with Senator Schumer, with all of us, going through the areas that they would disinvest for families, take away quality of life, take away services. The backdrop of that is the fact that he's going to do another huge tax cut for billionaires and corporations. $2 trillion before, says he wants to do it again, while we're talking about priorities that American families care about. So let me talk about health care. They want to send the cost of health care and prescription drugs soaring again and rip health care literally away from tens of millions of Americans. Their agenda will increase prescription drug costs because they want to repeal everything we're doing. Not only the $35 cap per month on insulin, but as of the beginning of the year, there's a $2,000 total out-of-pocket cost for, there's a cap for anyone on Medicare, $2,000 a year. So if you've got cancer treatments for $10,000 a month, or you've got a multitude of other medicines, your total out-of-pocket cost will be capped at $2,000 a year. Donald Trump and his supporters want to end that. We also know, and by the way, over 4 million seniors get the $35 insulin cap, and we know that even more will get the total cap. And the administration just rolled out the new negotiated prices for the top 10 drugs under Medicare, cutting by 40% up to 80% the cost. And they want to stop that as well. They will hike healthcare premiums by ending the ACA tax credits. They want to end the requirements that people with pre-existing conditions are covered, which is a majority of people in this country. And they want to stop maternity care coverage as a required benefit, something I fought very hard for and led in the Finance Committee. Maternity care coverage. They want to take away the requirement to cover having babies and women on maternity care. They also want to expand junk plans that cost a lot and don't cover anything. They want to rip the children's health insurance program away from children. So here's the thing. We are working as Democrats with Vice President Harris to build on the progress that we have already made to cut costs and to make sure Americans get the care they need. The contrast could not be clearer on who's on the side of the American people and who is on the side of the wealthy corporations and billionaires of this country. On behalf of people in Michigan, I can tell you, we don't want to go back.
Thank you. Senator Smith on women's health.
Well, thank you. Good afternoon, everyone. So Project 2025 is a plan to give Donald Trump, should he become president again, unchecked power. And I want to just take a moment to talk about what that means for women's health care and for women in this country. At the debate this week, Donald Trump refused to commit that he would veto a national abortion ban. And he also said, oh, that will never happen. But American women know that he can't be trusted to respect women's right to make their own decisions about their own bodies and their own lives. And Project 2025 is a roadmap for how he would get there. We know that Donald Trump is directly responsible for taking away reproductive freedom and for the Trump abortion bans that now impact the lives of 1 in 3 women of childbearing age in this country. So let's take a look at what Project 2025 has to say about this issue, which is so important. And remember, this 900-plus page plan was written by Trump's former staff and his advisors and the people that are likely to be staffing and having positions of authority in the Department of Human Services and other important federal departments when it comes to women's health. Project 2025 describes a future where the government is firmly in control of women's bodies and women's lives. It calls for every abortion, miscarriage, stillbirth, and pregnancy loss from medical treatments such as chemo to be reported to the federal government. I mean, this is pregnancy monitoring designed to turn the federal government into the pregnancy police. And this isn't just creepy, it's dangerous. I mean, think about the impact that this would have on women who are making decisions about the health care that they're seeking out and thinking to themselves, like, if I go and I seek out this health care, who is this going to be reported to? What does that mean about what people will know about my private personal decisions? So instead of keeping politicians and judges out of the doctor's offices, these folks want to do exactly the opposite. Project 2025 lays out specifically how a second Trump administration would misuse this old antiquated law called the Comstock Act to ban medication abortion and potentially all abortions without a single act of Congress. And if you wonder whether this is true or not, Jonathan Mitchell, who is one of the architects of Project 2025, was really clear. He said, we don't even need a federal ban when we have Comstock on the books. That's what their plan is. They intend to give a future President Trump unchecked power to control women's bodies. Donald Trump and his extremist Republicans that are behind Project 2025, they can try to run away from these incredibly unpopular ideas and platforms, but American women and the American people will not be conned.
Thank you, Tina. Okay, now we have Senator Kelly on veterans, a veteran himself.
So it gets worse, folks, on health care specifically. So one of our country's most sacred promises is to care for our service members when they get home, when they return from overseas especially, and returning from combat. In Arizona, we've got about 500,000 veterans. As a veteran myself, this could not be more important to me. And Project 2025 to veterans is offensive. Veterans deserve the very best care that our country can provide. It's that simple. But right now, Project 2025, it threatens to dismantle the VA healthcare system. Does a number of things. I'm going to go through about 4 of them here. So first, it disenrolls potentially millions of veterans from VA healthcare. I don't know how many veterans we might even have in this room, but you could potentially be removed from your health care through the VA. It also outsources medical examinations, and it automates claim reviews and decisions. So veterans will wind up having to talk to a chatbot instead of talking to a trained VA employee. It also cuts benefits for current disabled veterans. So it's going to take money out of their pockets. And it's going to roll back the rating scale so that disabled veterans of future wars will receive fewer benefits, or in a lot of cases, they're not going to receive any benefits. It also creates a panel to downsize or close VA hospitals, while also requiring that the providers that are left, that still exist, increase the number of patients that they're going to have to see. And what does that lead to? Leads to worse care for our veterans. So let's be clear. This plan is nothing more than a path to full privatization of VA healthcare. And it takes away benefits from our veterans. It's all put on their backs. Now, I've spoken to veterans across Arizona. We have a lot of them, and they are really worried about losing the access that they currently have to their doctors. And they realize that if this gets passed, that they're going to have to fight even harder now to get the care and the benefits that they've earned through their service. Gutting and outsourcing the VA is not the solution. We need to focus on real reforms that improve care, reduce wait times, and make sure veterans can access the benefits that they deserve without sacrificing the system that they depend on. In Project 2025, it's very clear to me that this is offensive to veterans. Thank you.
Finally, Senator Warnock on housing.
Project 2025 is bad news for America. And virtually no one is left unscathed. As my colleagues have already demonstrated, from veterans to preschoolers to women, no one is left unscathed by this. There's a reason why Donald Trump is running from Project 2025. He knows it's bad news. The fact that they're running away from it tells you everything you need to know. Who in the world wants to get rid of Head Start? I know that Senator Stabenow talked about education, but Head Start works. I know it because I've seen it in the communities where I've served for decades as a pastor, and I know it because I'm a Head Start alum. I know the difference that this program makes for poor children and their access to education, the ways in which it stirs that early intellectual curiosity and imagination and puts you on a path towards a prosperous and productive life. Who wants to come after the $35 cap on insulin? So on a whole range of issues, this is bad news. But in every corner of Georgia, one of the top issues that I hear about is the housing affordability and availability crisis. According to the National Low Income Housing Coalition in Georgia, there's an estimated statewide shortage of 200,000 rental homes that are affordable and available for low-income renters, shortage of 200,000. And industry research has found that from 2023 to 2024, Georgia lost 7.5% of its housing inventory and one of the biggest decreases in the nation. I sit on the Banking, Housing, and Urban Affairs Committee, and this crisis is something that we've been working on for quite some time. We've tried to address this crisis, to lower housing costs on working people, to help first-time American buyers purchase a home of their own, and strengthen transparency in our rental and housing markets to help regular people put a roof over their heads. Housing is dignity. Housing is security. Housing is safety. So let's be clear. Project 2025, which was written by former President Trump's friends and allies, would not just kill these efforts to make it easier for Americans to obtain their piece of the American dream through home ownership or to find safe, affordable housing. Washington Republicans' Project 2025 would increase housing costs on working families. and undermine the work necessary to expand access to affordable rental, and home ownership opportunities across the country. Let me list just a few specific examples. Project 2025 calls for privatizing Fannie Mae and Freddie Mae and limiting Americans' access to federal mortgage programs. Who does that serve? This would spike mortgage prices and undermine access to the fixed rate 30-year mortgage so many Americans have used to afford their homes and build generational wealth. These moves would make it more expensive and much harder for Americans to purchase and to own their own home. Project 2025 would prohibit the federal housing investments we're fighting for right now that would expand the housing supply and thereby lowering housing costs. Everyone who's looked at this knows that one of the things we've got to do is address supply. Project 2025 would prevent the Department of Housing and Urban Development, HUD, from protecting homeowners from housing discrimination, including discrimination in property appraisals. And I know that I don't have to remind this group of journalists that have been reporting on this issue of the ways in which in recent years black homeowners and consumers of color are economically disadvantaged by bigoted practices in our housing markets in general and the appraisal system in particular. Project 2025 would eliminate the National Flood Insurance Program and other initiatives and protections that help lower utility costs and protect houses from extreme weather events, just as we're seeing more of these natural disasters putting people's homes in jeopardy. As a coastal Georgia native, I can tell you that this would put countless homes down in Savannah, Georgia, and other coastal areas at risk, and it would increase costs for families who have to repair and rebuild after extreme weather events, which we are seeing more and more. This is all just the tip of the spear. But the bottom line is this: we're trying to make housing more affordable for more Americans and make it easier for Americans to find or purchase a home, while Project 2025 would raise your housing costs. Project 2025 is bad news for housing, bad news for veterans, bad news for Head Start, bad news for seniors who are trying to afford prescription drugs. Almost no one is left unscathed. We need a president who will center the people.
Thank you. Thank my colleagues for those great presentations. Now, you know, we faced a very hard job because we're trying to find the 10 worst things in 2025, and it's a severe competition in Project 2025. Next week, we'll be doing another 5, but let me just say what they are specifically. Eliminating Head Start and abolishing Education 1. 2, repealing the insulin cap, the $35 insulin cap. 3, paving way for a national abortion ban and monitoring women's pregnancies. 4, eliminating Fannie and Freddie, dramatically raising prices. 5, total VA privatization. Hundreds of VA facilities could close. You'll hear 5 more next week, and at that point we will sum up the 10 worst. Questions? Yes. Let's first do questions on this subject, and then I'll get to you. Okay?
Donald Trump continues to try to distance himself from Project 2025. One way is by proposing that he wants to make IVF free for families. Does the Senate plan on putting that theory to test by bringing legislation back to the floor?
Stay tuned. Yes.
So going off of that, the former president has indicated that he would likely not sign a national abortion ban. What do you make of this and contrasting that with all?
Look at everything he said over the years. Look at everything he said over the years, proudly bragging that he put the people on the Supreme Court who repealed Roe v. Wade. No one believes him. Everyone knows what he's going to do. Yes.
Thank you, Senator Schumer. You all spent the last 5 to 6 weeks back home in your districts. Is this message penetrating with your constituents?
Yes.
Do you feel like it's resonating?
It is utterly amazed. I was pleasantly amazed when we saw the polling data that over 65% of Americans had heard of Project 2025, and 3/4 of those knows it's very bad. It's amazing. It's really hit home. And that's why it came up in the debate, and that's why Trump was so defensive about it in the debate. Yes.
Trump called parts of this plan abysmal and he disavowed it.
Because this is this is what Trump will do. These are his supporters. They spent months together figuring out what to do. We know that Donald Trump will just say something on a dime because he's under pressure. Everyone knows this is his plan, not what he's trying to run on right now because he knows what he wants to do is so unpopular. Yes, in the back.
Is this resonating in the Montana Senate race at all? And is there a need for a change of strategy there, given the polling that shows?
Look, John Tester's going to win that race. Everyone knows he represents Montana very well. This is resonating in every part of the country. Last one.
The document says hits DEI pretty hard, and in the Treasury Department specifically, it says that their plan is to haul in every Treasury official that has. And I was wondering if there is a need for, if you're looking at federal protection.
Well, we're going to have 5 more of the 10 worst next week. Okay? Now you get the last question on a off topic.
Yesterday, a group of Republicans stood where you all are standing and said basically if Democrats don't pass the SAVE Act, they will be held to pay, especially when it comes to January 6th. Again, we know what happened a few years ago. So my question to you is, will you put it on the floor even as a standalone? And if not, what are your concerns with it?
Let me just say, we're not going to get into detailed negotiations. As we've said before, we need a bipartisan bill where everyone comes together and figures out what to do. As you've seen, the chaos in the House, because Speaker Johnson is trying to do this in a partisan way, guided by the far right, he's not getting anywhere. Thank you, everybody.